Kootenay East.
Well, thank you, Honourable Speaker, and I rise today in support of my colleague's motion. Be it resolved that this House agree that the current measures are not adequately address the opioid epidemic and commit to making mental health and addictions a priority here in British Columbia. I want to begin my remarks today by expressing my condolences to every family member, every friend, every colleague and neighbour who grieve the loss of someone they love to addiction. Day by day, that number sadly continues to rise. Each month, the BC Coroner's Service releases its illicit drug overdose report, and we all brace ourselves for more tragic news. The latest report, released last week, showed July was the second deadliest month ever recorded in British Columbia. Our province lost 184 more people. That is 6 people per day. It's staggering, Honourable Speaker, and it's clear that whatever we're doing, it's not working. With these statistics as a backdrop, one has to wonder why on earth the Premier has recently cut funding for life-saving naloxone kits. These are essential tools for frontline emergency responders during this crisis. The official opposition has written to the Premier asking for the funding for these kits to be restored to police departments who are sounding the alarm. We have also asked him to activate the Select Standing Committee on Health to enable all parties to collaborate on actions to prevent further tragedy and loss in our province. But so far, these requests have been met with silence, which is astounding, given the importance and the urgency of this issue. People's lives are at stake, Honourable Speaker. They need access to life-saving naloxone. Just as important, they also need timely access to treatment options and mental health support, but they're not getting it. This is an issue across BC, not just in the major centres, but are also in rural communities like mine. When a person suffering from addiction is ready and willing to seek out help, we can't go and tell them it's not available and that they'll have to sit on a wait list for weeks or perhaps months. When they make that call, they need to be supported immediately. We need a comprehensive and seamless mental health and addiction system, one that isn't just reactionary or offering services that are too little too late. We must put them on a path to healing before it's too late, but that's not what we're seeing. Instead, the government continues to toot the significance of a dedicated ministry for mental health and addictions. I remember the announcement in July 2017 when the Premier glowed on how this dedicated ministry would greatly change the trajectory of mental health and addictions. At the time, Provincial Health Officer Dr. Perry Kendall questioned whether a new ministry dedicated to mental health and addiction would help, saying it could just add another layer of bureaucracy to the issue that is already drowning in red tape. Is that what we're seeing here some 4.5 years later? And as some in media have pointed out, the Ministry for Mental Health and Addictions has the smallest budget in government and spends most of it on staff. Another layer of bureaucracy indeed. It doesn't fund any programs and it can't control mental health or addiction services in other ministries. And although the Foundry program, founded during the time the BC Liberals were in power, is a godsend to many, and one such facility is coming to my community in Kootenay East, this ministry has no hand in the decision-making around where the Foundry Centres for Youth Services are located. It appears to be totally hands-off on all fronts. To sum up, Honourable Speaker, it's useless. What a damning indictment. What has this Premier and his government done to prove the media reports wrong or to change the trajectory of this ever-worsening situation? Absolutely nothing. They continue to plod along and insist they're working hard on this file and it's a top priority. 4.5 years ago, the Premier stated his first order of business was to go to Ottawa to meet the Prime Minister and talk about wildfires, talk about softwood, lumber, and talk about the fentanyl crisis. Well, none of us need to be reminded that since then, BC's had 2 of the worst forest fire seasons ever in this province. Softwood lumber is killing our cost of production and making our meals uncompetitive, and our opioid crisis has spiraled out of control. Our overdose numbers continue to climb, families continue to lose loved ones, and the government decides to cut funding for naloxone kits for police departments. This Premier has made many priorities and promises. 114,000 affordable homes, renters rebates, $10 daycare, forest mitigation, saving our softwood lumber, and resolving our opioid epidemic. Mr. Speaker, I'm finally realizing the words that make up the initialism NDP and is simply never delivering promises. So my challenge to the next member opposite to speak is to tell us what this government is going to do differently to finally get people the help they need. Thank you, Mr. Speaker.